What misconceptions about hormone optimization do you encounter most often, and how do you address them?
I think the biggest misconception that we all get is that testosterone is going to cause strokes and heart attacks and cancer. Those are probably the top three that I hear from people coming in, whether it be from the general media, the public, or from other physicians that are refusing treatment, and then these guys are coming in seeking treatment. My first answer to anyone that says testosterone is going to cause a heart attack, a stroke, cancer, etc., is I say whoever made that claim needs to prove their claim. You're going to make a claim, the burden of proof is on you. I don't need to prove that it doesn't. You need to prove that it does, right? Because you're the one that's claiming that a new event is going to occur if you use this input. And they can't. They cannot prove it. All I ever get is, well, my doctor's been doing this for 30 years. That's great. So he's been wrong for 30 years. That tells me nothing. A lot of people have been doing a lot of things for a very long time. It doesn't mean that they are correct. Heck, I've been wrong on a lot of things in life. The minute I am proven wrong, I change my tune, I apologize, I learn, and I develop a new path. That is what makes human beings so spectacular, is we can adapt, we can accept, and we can learn the right thing. Sticking to erroneous information for your ego is not going to help your ego in the long run, and it's certainly not going to help your patients. So rather than just opening up a debate and trying to stand my ground and prove them wrong, I just ask them to prove it. And they never can. They never can. And if anybody wants to have any ammunition in their back pocket regarding cardiovascular health and testosterone, in June of 2023, the largest study ever conducted with human beings and testosterone, specifically for cardiovascular health, was conducted and published. And it is called the Traverse trial. You can look it up. And it is fairly lengthy and it is fairly conclusive. And it clearly shows that men with low testosterone levels are at a far greater risk for all arteriosclerotic cardiovascular disease than men with optimal levels. And that is some of the most extensive and latest research that we have available. So anyone harping studies from the 70s, 80s, 90s that is purely correlative and inconclusive should refer to the newer and more conclusive studies and stop, beating the desk on nonsense. But that is probably the biggest misconception.